For a trauma patient, how are you going to end up at a trauma center? So I'm curious of your guys' take. So ambulance or like a car transport, right? Scoop and run is the best concept for trauma. Like versus an acute coronary syndrome or somebody that loses pulses in the field due to a myocardial infarction or a heart attack. It's actually this, you're supposed to get like an AICD and try to defibrillate them, because if they're in like VFib and you shock them, you're going to help this person, okay? But this is different in trauma. The whole idea in trauma is to get them to somewhere for hemorrhage control as quickly as possible. So EMS providers, and if someone's in the field, say like a police officer or something, scoop and run is the technique or idea in trauma. You want to be at a trauma center because you need a surgeon to stop the bleeding, okay? So definitely different than a witnessed cardiac arrest, okay? Now, helicopter transport, if you can't see my beautiful helicopter here, is reserved for any time we think transport is over 20 minutes, meeting again trauma criteria. And then sometimes we have patients that are transferred via air by airplane. Especially, we receive a lot of transfers from those patients that are overseas in the Caribbean especially. So they come via air transport as quickly as possible to us. So that's the typical methodology. But again, that concept of stay and play versus scoop and run is super important in trauma, and I'm curious what your guys' thoughts are there in the comments.